So my name is Mel Krajden. I'm the medical director of the Public Health Laboratory at the BC Centre for Disease Control. I'm also the medical head of hepatitis. And in the context of the CanHepC program, I am one of the PIs, and I oversee the Health Services and Policy Core. What we've done over about an 18-year period was to take the laboratory data where we have tested people in British Columbia. They test negative, they test positive. We've brought together all of this information on people tested for hepatitis C, identified with hepatitis B, tested for HIV, and created a very large data set. And this laboratory data that has very detailed positive and negative test results was brought together with the administrative data, which looks at the treatment of hepatitis C and other things, as well as the medical visits, the hospitalization data, the cancer registry, and their survival data or vital stats. And it's a very unique way of bringing together the information and trying to understand who is accessing testing, where is that testing taking place, how long does it take to be diagnosed? When you diagnose people, are they engaged into care? And what happens to them when they're treated? What happens with the earlier drugs, which were very ineffective? Those were all interferon-based. And now that we have very effective drugs called the direct-acting agents, we are monitoring both the uptake of those drugs and what the results and impacts are. One of the most telling things that we've been able to discover because of this integrated data set is that in terms of if you compare someone who's tested for hepatitis C but never got infected with hepatitis C, so they're hepatitis C antibody negative, their average lifespan in British Columbia is about 74 years. And if you compare that to the average lifespan of someone who is infected with hepatitis C, they're antibody positive, what we were able to show was that the difference is 19 years of life lost. In other words, so the average age would be in the 54, 55-year range if you're hep C positive. That's when you die, compared to 74 years if you're hepatitis C negative. We were also able to look at the relationship between what about the people who spontaneously clear? The people who spontaneously clear, and it's about 25% of people who get infected with hepatitis C spontaneously clear, those individuals are engaged in risk activities. And when we look at their mortality, it's almost the same as someone who's hep C positive. And this is consistent with results that have been shown from the US and in other jurisdictions, where essentially about half of the deaths that occur in relation to hepatitis C have nothing to do with the virus. It has to do with the acquisition risks that are crucial and obviously important for people's lives. So when we look at the people who are hep C positive and they are RNA positive, which means that they actually have evidence of chronic disease, their mortality is essentially the same as someone who's cleared their virus. So that means in this younger group of people, typically people who inject drugs, it's not just about curing them for their hepatitis C. It's about how do you support them in preventing their acquisition of hepatitis C, but also preventing them from dying from underlying risk activities. Like the US, BC has a baby boomer cohort. And that means that predominantly people born between 1945 and 64, form the bulk of people who have been infected with hepatitis C. And it's important for us to realize that those people actually got infected in the past. They have survived their acquisition risks. In other words, whatever got them infected, they're still alive. And they tend not to engage in transmission risk activities. So they're an aging group of people who have been infected for decades typically, and they are in need of treatment, and the treatments that are now available will really give them an opportunity to have a greater than 90–95% cure rate, which is really an outstanding development for hepatitis C. So what this data shows to us is that you can, in Canada, assemble these really complex data sets, but it can give you a view into what is happening in the context of hepatitis C, but more than just hepatitis C, what are the components that need to be brought to bear to save the lives of these individuals?